really happy to be joined by Wiebke Reichert, who is a medical student and Pilates teacher. My name is Zoe Clark. I'm Self-Management Programme Officer here at NASS. And for this evening's session, Wiebke is going to be doing a live Pilates session for you all. So hi Wiebke, how are you?
Hi, thanks Zoe. I'm fine, thank you. And hello everyone who's joining us today to do the Pilates session. Right, so the plan for today sort of is for me to talk a little bit about Pilates to begin with, so you get a nice overview of what Pilates is all about. I'm sure some of you have done Pilates in the past, others haven't. And then we'll do a little live session, do a couple of exercises together, and I want you to wear some comfortable clothes, have a mat, and you also need a little pillow. So go and grab a pillow right now if you haven't got one yet.
I'll keep an eye out on the comments as well. So if you're all set to go, say hi in comments. And if you've joined Wiebke's previous sessions with us, let us know as well. And if you do Pilates in general, it would be great to know your experiences, how you find it, if it helps you manage your axial SpA as well. Yeah, good just to have a chat in the comments. And at the end, we'll come back and have a Q&A together as well. So if you have any questions, please pop them there and we'll go through them all at the end as well. Yeah, so we'll give everyone a couple of minutes, just make sure they're all prepared and comfortable. If anyone who's watching isn't sure if Pilates is safe or appropriate for you, please do check with your doctor or your physiotherapist before trying the session. The session will stay on our Facebook page. We'll pop it on our YouTube page and our webpage, My AS My Life, so you can always come back and catch up afterwards and give it a go once you've had the go-ahead from your medical team. So I think that's covered everything in terms of the intro. Was there anything you wanted to add, Wiebke?
No, that's pretty much it. I just hope that everyone has fun and enjoys the session.
Absolutely. So yeah, I'll do is I'll switch my camera and mic off and I will leave you to it and then come back for the Q&A at the end.
Perfect.
Okay, thank you.
Right, okay, so hello everyone. As I said previously, we're going to do a little bit of Pilates today. I will quickly introduce myself just so you know who you're dealing with. So my name is Wiebke, I'm 27 years old. I studied chiropractic in the UK and I worked as a chiropractor for 3 years, but I'm currently studying medicine. In Germany, I also suffer from psoriatic arthritis, so I know what it's like to have joint pain, inflammatory joint pain. I sort of discovered Pilates through my work as a chiropractor, and I tried it out to reduce my joint pain and to manage my arthritis, and I realized that it really helped my pain, and that's why I sort of went down the Pilates route. And then today I want to just share my own personal experience with you, and hopefully there are a few of you there today who also find it very interesting to do Pilates and might actually start doing it themselves. So like I've just said, I will talk a little bit about Pilates to begin with, so you know what it's all about, and then we do a session together. So Pilates is mostly about strengthening muscles, strengthening joints, working on your balance and improve mobility. And you do that by mostly using your body weight. So there are certain types of Pilates where you use equipment, but the idea really is to just use your body weight, or movements are really slow and controlled, which is perfect for us as arthritis sufferers, because what you don't want to do is have like sudden quick movements and put extra pressure onto your joints. When you do Pilates, you mostly focus on your core or your core musculature. And I'm sure you've all heard about core musculature before, or core strength, but not many people actually know what core strength is all about. So I just quickly want to talk a little about that, because at the beginning of the exercise session, we will focus on strengthening our core muscles and engaging those core muscles. And luckily, I have a tin of beans, because I'm going to explain everything about core musculature by using the analogy of a tin of beans. Mark's been sent me that one from the UK. So when you've got a tin of beans, you have the side bits, you've got the top, and you've got the bottom bit, right? And when you think about your core musculature, you kind of have to think about these 3 bits: sides, top, and bottom. And the side bits that wrap around are basically your muscles that surround your spine. So you've got your tummy muscles, your muscle at the side, and you've got the muscles at the back that brace your spine. And you need to be strong around that spine to support your spine, because if you aren't strong around there, you put more pressure onto your discs, you put more pressure onto your joints and your back, and that will cause more pain, especially if you've got inflammation in your spine. And then we've got the bottom bit of the tin, which in our case is our pelvic floor musculature. Women and men have pelvic floor musculature, because often men don't really know or aren't aware of that. And these muscles at the bottom are muscles that we often don't think about and we don't often actively engage. But if you think about the tin, if the bottom bit is loose, well, then your baked beans fall through. And it's the same thing for your pelvic floor musculature. If the pelvic floor isn't lifted, you have no support from the bottom, and you can try and brace your spine and brace it as much as you can, it won't make a huge difference. And then you've got the top bit, which is the lid, which in our case is our diaphragm. So the diaphragm is a little muscle that sits between our chest cavity and our abdominal cavity. And it's involved with breathing. So when you breathe in, it contracts and it goes down. So you've got more space in your chest cavity because your lungs want to fill with air. And then when you breathe out, the diaphragm relaxes and you go back to normal positioning. So as you realize, you engage that muscle through breathing. And these three bits, the muscles that wrap around your spine, your pelvic floor muscles, and then your diaphragm are important to work on your core strength. And I'll show you in a second how you engage those muscles. And when you do the exercise, you try to engage those muscles all the time. It doesn't have to be maximum contraction because you won't be able to hold that, but just a little bit of engagement in all these muscles. And then think about doing that even during your normal daily activities. I don't know, like cleaning the house, something like that. Embrace that core. So that's what I want you to know before we start with the exercises. Apart from that, I might give you a couple of levels while doing the exercises. Don't feel like you have to go through every single level. We'll start with level 1. And if that's the one you're comfortable with, just stick with that one, okay? I don't want you to feel sore or to be uncomfortable while you do the exercises, because then you don't have any. Okay, so stick with what you're comfortable with. Don't overdo it. Sometimes when I have a bad day, I do level 1 and I still feel like mobile and better afterwards. And if you haven't heard it yet, then do grab a little pillow, because one of the exercises will be on our sides and we need some support for our head. Right, and that will be it. So now I'm going to move you around with the camera, so bear with me for 1 second, because I'm in my little studio flat at university and I don't have that much space. So just let me just double check that you can see me. Perfect. Right. Okay. We're going to start with our starting position for Pilates. So what I want you to do is bring your feet all the way together so that they're touching each other. Bring your weight onto your heels, so you're standing in a V shape. And then bring your weight onto your toes and bring your heels out. So your feet should be now roughly hip distance apart, okay? If you normally stand with a natural turnout, then do move your feet so you've got a bit of a natural turnout, okay? I want you to be comfortable. I don't want you to stand there and feel like, right, this is not how I normally stand, because then you're not moving your muscles in the correct way, okay? Have a bit of a bend in your knees. Slight bend, not too much, but just don't lock out those knee joints. Right, and we're going to start by engaging those core muscles I just thought about. First thing, side of the tin, muscles that brace your spine. Think about your belly button and try to draw that belly button in. So as if you had a belt around your waist and you're trying to tighten it, okay? So gently draw in that belly button, step by step by step, okay? Try to not let go while you're pulling it in. Just try to engage it as much as you can. You will initially feel it more at the front, and you might feel a bit more at the side, maybe a little bit at the back. Try to get to your maximum tension and hold it there. And I'm going to count down from 5, and I want you to keep that maximum tension. 5, 4, 3, 2, 1, and let go. Right, so now you know how to engage these muscles. It will take some practice, but if you do it every day, you'll get the hang of it. For our Pilates session, you want to have about 30 to 40% of engagement. So if you said you pulled it in 10 times, 3 to 4 notches on your belt, basically. Okay, no maximum tension, you won't be able to hold that 3 to 4 notches, 30 to 40%. Now we're going to focus on our pelvic floor muscles. That is going to be a little bit more difficult. So what I want you to think about is you're desperate for the toilet and you're trying to hold it in. Those are the muscles you need to engage. And the pelvic floor engagement is kind of like a lift. So you do the same thing that you did with your abdominals, but you lift those muscles, again, step by step by step. Make sure you keep your bum muscles relaxed. It's very easy for us to clench the bum muscles as well, but those are not the ones we want to engage. We want to lift that pelvic floor, again, 10 times if you can, get to that maximum tension. I'll give you a few more seconds. Maintain the 30 to 40% here if you can, okay? Right, maximum tension in that pelvic floor. Try to get maximum tension in your abdominals as well. Now count down from 5. 5, 4, 3, 2, 1. Relax everything. Right, so now you know how to engage the abdominals. Now you know how to engage the pelvic floor muscles. Practice that. And the last bit, the diaphragm, the muscle between here, that is the breathing, okay? So when you engage your abdominals a little bit, you lift that pelvic floor a little bit. Make sure you don't breathe into your abdomen, okay? So if you pull in that belly button and you try to breathe into it, you're doing the opposite movement, okay? So you're breathing into your chest, but don't breathe into your shoulders. So don't try to lift up your shoulders. What you're really trying to do is you're breathing into the side of your chest. That is very difficult, but your chest should go out and in, okay? That's what we do. And when we breathe through doing Pilates, we breathe in through our nose and we breathe out through our mouth. But while we're doing the exercises, I will tell you a little bit, I will remind you to engage that core, to lift that pelvic floor, breathe in through your mouth, breathe in through your nose, breathe out through your mouth. Good, perfect, right. So, feet are hip distance apart, 30 to 40% abdominals, 30 to 40% pelvic floor, breathing into the chest. The first thing I want you to do is to mobilize your pelvis. And I show you that exercise from this side. So, hands on the hips. And what I want you to do is angle that pelvis. Rotate your pelvis forwards and backwards, forwards and backwards. Keep your upper body as stable as you can, okay? Small movements to begin with, and make those movements bigger and bigger and bigger. Don't over arch your back, so don't do any of this, okay? Is everything here stable? Just movement from the pelvis, movement from the lumbar spine. Only open up as far as you want to. If you want to have a bit more movement, you can bend your knees a little bit and you'll notice you have more. But if you don't want to do that, you don't have to. Keep that engagement in the abdominals, keep that engagement in your pelvic floor. Now make the movement smaller and smaller and smaller, and stop halfway between those two movements. Right, and this is what we call the neutral pelvis. So this is where your pelvis isn't too far forwards, too far backwards. And this is where your abdominals and your core muscles can work the best, okay? So that's also something I want you to practice at home, just in general, to engage your core and to stand properly and to have your joints at the right angle. Okay, good. And I just want us to mobilize everything a little bit. We've got the pelvis. Now we're going to focus on our shoulders. I just want you to just rotate your shoulders. Just start with small movements and just make them bigger and bigger and bigger. Bring in those elbows, but make sure that your spine remains in the same position, okay? So don't lean backwards, don't lean forwards, just rotation from the shoulder joints. Bring your arms all the way up. You can do it with breathing if you want to. Breathe in through your nose when you go up, out through your mouth when you come back down. Everyone at their own time. Just a few more big shoulder rolls. Lovely, well done everyone. And I'll make them smaller, 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 smaller. And I want you to make sure that you put your shoulder blades nicely back and down with your last rotation. Good, just they're sat right here and you're not slouching forwards. Good. And now we're going to work a little bit on our side to side movement. So I want you to have your hands down either side of your leg, core engaged, 30%, pelvic floor lifted, feet hip distance apart. You breathe in through your nose, and when you breathe out, you run down the side of your leg, go as fast as you can, and when you breathe in again, you come back to the center. You breathe out to the side, you breathe in to the center. Make sure you keep those abdominals engaged, especially when you lean to the side. It's very easy to lose that. So if you feel like your belly's kind of like pushing out a little bit, then you're losing the engagement. You almost have to draw on your belly button a little bit harder when you go to the side. Make sure that you try to be even when you go to either side. So if you feel like you've got one side that's a bit stiffer than the other, then don't try to push further with the one that's more mobile, okay? Because you're just pushing everything in the wrong direction. So even and a nice breathe in. Almost try to get your abdominals to pull you back into the center. So engage those abdominals and back into the center. Lovely. Breathe out through your mouth, in through your nose. Good. So you guys carry on, and I'll show you a next level. If anyone wants to join, they can. If they don't want to, they don't have to. You can bring your arms into the system. So you can bring your arms either placed on either side or on your forehead and do the same movement. To the side and back to the center. You notice that you've got a bit more weight now, so your core musculature has to work harder to bring you back to the center, okay? So if you don't feel comfortable, you don't have to do it. Make sure that your hips remain stable so you're not moving from one side to another, okay? Keep that pelvic floor lifted. I'm sure that some of you have already forgotten about that. And then once more to one side, and then once more to the other side. Good, well done everyone. Lovely. And come back to the center. Good. Rest your arms, shake your legs. Now we sort of mobilize everything, lower back, sides. And now we're going to work a little bit on our balance. So back into our standing position, starting position, feet hips distance apart, knees a little bit bent, pelvis in that neutral position, abdominals engaged, and pelvic floor lifted. Now I'll show you the next exercise again from the side. The first thing I want you to do is when you breathe in through your nose, and when you breathe out through your mouth, you lean forwards without lifting your feet off the ground, okay? So you're just shifting your center of gravity. And you notice that when you go forwards, you have to engage your abdominals a little bit more to stop yourself from falling over, okay? So body in the same position is kind of just your ankle joint that moves a little bit, and that's about it, okay? So leaning forwards, coming back, and again, leaning forwards, breathe out when you lean forward, breathe in through your nose when you come back in. Pelvic floor lifted, abdominals should be engaged, otherwise you would be falling over. So really get to that point where you feel like you're almost losing your balance, but not falling over. Good. Carry on, and I'll show you again from the front. So leaning forwards, so you get to that point where you're almost losing your balance. And that's also a very good exercise. There are lots and lots of levels with this one, but I'll show you. You're going to do like 3, so this is level 1. There's some levels that I cannot do, so this is a very, very good exercise, especially if people want to progress through different stages. Right, again, breathe out when you lean forward, and then come back, breathe in. So now I want you to bring your feet and your toes into it a little bit as well. So next time when you lean forward, you can go onto your toes and go up, and then you come back down onto your heels. And again, when you breathe out, you go onto your toes. When you go forwards, back onto the heels and back. And now you notice when you go up, you're on your toes. You need to engage your abdominals again a little bit more. You need to lift that pelvic floor to not lose your balance. If you're struggling because you can't stand on your toes, because your ankles are a bit dodgy, carry on with just leaning forwards and backwards. And I think we can all say that just leaning forwards and backwards engages our core muscles. And that's what I like about Pilates, because you don't have to do crazy exercises rolling around on the floor to see some results. Good. And I'm going to show you just another level, which is with arms, and you can do that with your toes or without your toes, which is bringing your arms forwards when you lean forwards. Yeah. So if you're not on your toes, do it without the toes, but you don't have to. You can bring them up to your shoulder height, first of all. You can bring them up to your ears if you want to, but make sure that you're not losing your normal spinal position, okay? So that you're not overarching if you lift them too high, or just be controlled, okay? Well done, everyone. We'll do 2 more of whatever level we are doing right now. Keep that pelvic floor lifted. Breathe out when you lean forward. And then engage your core. Right, well done. Shake everything off. Right, and now we're going to do a little exercise, which is kind of a transitioning from standing to going onto the mat. We'll do that one in this position. When I'm on the mat, I move the camera so you can see the rest. And this exercise is called a roll down. So it's a stretch of all of the back muscles, okay? I'll show you that one from the sides again. And you go as far as you want to. There's no exercise for you to touch the floor or anything like that. If you are able to touch the floor, then well done, but it's, you're not aiming for that. It's about mobility. So back into your normal positioning, okay? Feet hip distance apart. Pelvis in that neutral positioning. You're not overarching, you're not slouching. Abdominals engaged, pelvic floor lifted, okay? And what we're going to do is slowly roll our spine forwards, step by step by step. You go as low as you can, and then we come back up and we restack our spine. We can do the first one together, and then we do 1.5 more, so we end up on the floor sort of thing. And you do that one at your own time. If you want to go a little bit slower, go slower, but I'll sort of like guide you a little bit through the first one. Right, so everyone nice and straight. We take a deep breath in through our nose. And when we breathe out, we just let our chin drop onto our chest. Just let the chin drop first of all. And then you let your shoulders drop. And then you slowly roll down step by step. You have your weight on your toes, okay? So forwards, don't lean backwards. I don't want you to sit backwards. I want you to lean forwards. Now you go as low as you can. I might disappear out of the video in a sec, but I'm still here. Like I said to you, there's no aim to touch the floor. You just go for as low as you can, okay? When you're at the bottom, you take a breath in again through your nose, and when you breathe out, you restart that spine. You come back up, step by step. Really feel how you're putting each vertebra back onto the next one, okay? Very, very good way to mobilize the spine until you're back at the top. You bring your shoulders back, roll the rest down, you stand up straight. Okay, everyone. So I want you all at your own time to do 1 more down and up, and then 1 more down, and you go into the mat. If you're struggling to go into the mat from the downward position, basically, you come back up and then you go onto the mat. Okay? So everyone at their own time. Breathing in, breathing out, and then step by step, weight onto the front, and make sure you keep those abdominals engaged, especially when you're leaning forwards. It's very easy to just let that belly sort of come out. But even though we're leaning forwards, we are trying to engage that core. But yeah, this is also a very good exercise to mobilize. So it shouldn't, like in the morning, it's good. It shouldn't be your first exercise, especially if you're stiff in the morning. But once you've done a few other ones, like for example, the pelvic tilts, then this is a very good one. Good. And again. everyone at their own time. And then when we are done, I'll move the camera and we go onto the mat. Perfect. Good. So I want you guys to carry on, and then I'll move the camera so you can see me. So that should be okay. Lovely. So next thing I want you to do is to lie onto your backs. Okay. And what we're gonna do, I think you can see my head. There we go. No, I think that's it. Right. Onto your backs, and we're gonna do a glute bridge. And I'm sure most of you have done glute bridges before. But a very good exercise to engage the core muscles, to engage the glute muscles as well. So the first thing I want you to do is to put your pelvis in the correct position, okay? So you kind of do the same thing that we did standing up, which is tilting that pelvis backwards and forwards, okay? So push it against the mat and lift your pelvis off the floor. Make that movement smaller again, smaller and smaller and smaller, and then you stop halfway through to find that neutral pelvis. You can double check by checking whether you can just about get some fingers underneath your back. If you can get your whole hand underneath, you are too far off the mat. If you can't get your fingers underneath at all, you're too close to the mat, okay? Never have a gap, and that should be it. Right, hands down either side. And now you're going to breathe in through your nose. Engage those core muscles, lift that pelvic floor. Clench those bum muscles, and when you breathe out, you slowly roll yourself off the mat. And you go as high as you can, okay? If this is how far you can go, that's fine, yeah? So you don't need to bring your bum all the way to the top, especially if you've got osteoporosis or osteopenia, you don't want to go as high, okay? And when you're at the top, you breathe in through your nose again, and when you breathe out, you slowly roll yourself down onto the mat, okay? This is an exercise that has to be performed well controlled, okay? So I don't want you to go up, down, because I want you to do your glute bridges at your own pace, okay? You go as high as you want, and you go as low as you want, okay? But I always say it should take you at least 5 seconds to go from up to down or down to up, okay? So take your time and make sure that those bum muscles, those glute muscles, are always solid, yeah? So that they're contracting when you go up and when you go down. And always breathe out when you're moving. Keep those belly buttons drawn in. Lift that pelvic floor. Take your time. Perfect. So, and then come back down. I'm going to give you a couple of different levels. Again, you don't have to do those levels. It's up to you really. So what you can do, for example, is when you're at the top, is lift one heel off the floor, just the heel, one side, other side, come back down. And you'll notice that when you do that, your bum muscles have to engage just a little bit more to stop you from dropping your bum, okay? So that is important. So if you do that, make sure that your bum stays up here. If you've noticed that it drops, it comes down, then you just revert back to the normal glute bridge. Perfect. Pelvic floor lifted, abdominals engaged. And again, one heel off if you want to, other heel off if you want to, and come back down. Right. Now I'm going to give you another option. You can do that with the heel lift, without the heel lift, totally up to you, which is to bring your arms in, okay? So you can lift your arms off the floor. You can bring them as far as this, over your head, or you can bring them all the way to the floor, whatever you're comfortable with. And then when you come back down, you bring your arms back in. You can combine that with a heel lift if you want to.
but you don't have to. Again, just an option, because you notice you're a bit more stable. But the most important thing is that you're not dropping your bum and that your bum muscles are contracting. So if you don't feel comfortable, you don't need to do it. So 2 more, everyone. 2 lovely glute bridges of whatever level you want to do. Basic glute bridge, heel lift, arm movement. It really doesn't matter. And everyone focuses on their core engagement as well. Everyone tries to lift that pelvic floor. Everyone tries to join that belly button. Think about the breathing. You're breathing out when you're moving. You're breathing in between the different movements. Good. Well done, everyone. Just straighten out your leg, shake them out a little bit, shake out those arms. Good. That's a hard one, and I know. And now we're going to do just a little bit more for our abdominal musculature as well, for our bum muscles, okay? Back into the starting positioning, okay? Pelvis in the correct position. Don't be too arched, especially for this exercise. For this exercise, it might even be better to be a bit closer to the floor. So if you really want to, what you call in Pilates, imprint, which means you imprint the whole back onto the mat, then this is fine, okay? But avoid being too far off the mat, okay? So, and this time what I want you to do is engage those core muscles, breathe in through your nose, and when you breathe out through your mouth, I want you to bring one leg up into what we call the tabletop position, okay? So leave it up there and hold it. Your shins should be roughly parallel to the floor, but you don't have to, okay? So that's up to you. Breathe in and breathe out and bring the other leg up to tabletop, okay? And you can, and now we've got 2 options. So you can either just try and tip down with those legs. There we go. Perfect. And the other side. Or if you want to do a little bit more, you can also place your hands on your thighs and you can push with your hand against your thigh and with your thigh against your hand. And when you do that, you notice that your abdominals engage quite a lot. So you can do it that way. Hold it for 5 seconds and release. On the other side, hold it for 5 seconds and release. And then alternate, yeah? So either tip down, breathe out when you're tipping down, make sure you maintain that neutral pelvis, perfect. Or hands on your thighs, 5 seconds into the thigh, relax, other thigh, 5 seconds, and relax. We don't do the exercise for very long, but it just engages the abdominals just a little bit more. Good. And again, there you go. Lovely. And there we go. Good. Or tipping down. Lovely. Good. I want you to do one on each side of whatever level you're doing right now, okay? So tip down ones with the right leg, ones with the left leg, or push for 5 seconds into one thigh, 5 seconds into the other thigh. Perfect. And then you bring both legs down. And I just want you to do like a full body stretch. Just straighten all those legs, lift those arms up, and just really stretch out those abdominals. Good. Perfect. Well done. Right. And now I want us to dive onto our sides. Okay. So, and for that one, oh no, we don't need the pillow yet. For the next one, we need the pillow. Right. Onto our sides in one line. Okay. So make sure that your legs aren't forwards and that you're not rolling over onto your bum cheek. So you try to be aside. So if you are struggling with your shoulder, you can use the pillow for this one. Okay. So you bring your arm this way, so it's in front of you, and then place the pillow underneath your head. Yeah. If you're struggling with your shoulder, that's okay. Otherwise, just arm above your head. Now I want you to bend both knees so that your feet are roughly in line with your pelvis. And I want you to straighten out that top leg again. So bottom leg is bent, top leg is straight. And then your top hand here is just resting slightly on the mat, okay? I don't want you to lean onto the hand because you tend to roll forwards. So, but a bit of support is okay. Make sure you're not over arching your back, so you're not pushing out that bum. Okay, think about that neutral pelvis again. Draw in the belly button and lift the pelvic floor. And what I want you to do is when you breathe out, is to lift up that leg with your toes pointed. You can't see my foot right now, I don't think. Oh, I don't know. And then you bring in those toes when you come back down. Okay, so lifting up the leg with the toes pointing, and then you pull your toes towards yourself when you come back down. Always when you breathe out, you lift up your leg. You breathe in when you come back down. You can rest your leg in between those movements, or you can try to keep your leg in the air without it touching the floor. You can alternate, you can do 5, 6 in the air, then rest in between. It doesn't matter. This is a difficult exercise, so it's kind of like the previous one. We don't do too many of these. Very good to support the spine, the pelvis, but you probably also have noticed that it really gives you a burn at the side of your leg, okay? If you want to, you can place your top hand onto your pelvis, but you have to make sure you're not wobbling and moving around. Okay, so I want everyone to do 3 more, okay? 3 more of these. Breathe out when you lift your leg up, and then breathe in when you come back down. Good. Perfect, lovely, well done. Bring that leg forward, rub it a little bit, just to release the tension in your bum. And now I want you all to grab your pillows. Right. And then you lie onto your side, head on the pillow, arms in front of you, both knees bent. And this is more of a mobility exercise, just to mobilize the back a little bit. And I'll just quickly show you how to do it. But what you're doing is when you breathe out, is you rotate your chest and your top bit, and you come around. Your head follows the line of your hand, and you try to go as far as you can. Make sure your pelvis doesn't fall, doesn't rotate. Everything down here is stable. Just your chest opens up. You go for as far as you can, and then you breathe in again. And when you breathe out, you come back to here. You can hold your arm out for a little bit longer if you want to. You can just move it, come back. Everyone at their own pace, everyone at their own time. Make sure you keep everything here stable. Okay? So breathe in through your nose. And when you breathe out, you come around and you go as far as you can. And back, you breathe back in. And when you breathe out, you come back to neutral. Well done, everyone. So I want everyone to do 5 of these, okay? 5 rotations. Perfect. And again. Move. There we go. And you come back. Perfect. And again. Make sure you're still engaging those abdominals a little bit, okay? And make sure you still keep that pelvic floor lifted, because it's very easy for you to not think about it because you're kind of relaxing a little bit. So, because I've been talking, I'm not sure, but I think I've done 5, but I'll just do 1 more just in case. And some of you might be doing it a little bit more slowly. So, an extra 1 is always good. Good. And now we're going to do the same thing on the other side. So first of all, there we go. That exercise, lie in a straight line. Or if you're struggling with your shoulder, pillow underneath your head, that arm in front of you, no problem at all. Then bring both legs in, heels roughly in line with your pelvis, top leg straight again. Yeah. Pelvis in neutral position, abdominals engaged, pelvic floor lifted. Top hand Place it gently just in front of you. Don't lean onto it, otherwise you're rolling forwards. You breathe in through your nose, and when you breathe out, you lift up that leg, toes are pointed, you pull your toes towards yourself, and you come back in. Lovely. And again, toes out, and come back in. You can rest your leg in between, like last, on the other side. You can hold it in the air. You can do 4 in the air, and then you rest it. The most important thing is that you're stable here, that you're not moving around, that you're not leaning onto that hand. You also don't need to bring your leg as high, okay? So it really doesn't matter. As long as you're feeling something working here at the side, in that case, you're doing it the right way. If you want to, you can place a hand onto your hip. That will engage your core muscles a little bit more, but there is no need. Good. I want everyone to do 2 more. Rest in between, it doesn't matter. Keep them in the air. Hands on the hips, hands on the mat. It really doesn't matter. Good. Perfect. Well done, everyone. Rub and tap that leg a little bit. Get rid of the tightness in your bum. This is a horrible exercise, I know. But unfortunately, lots of people have weakness in that muscle at the side. And especially if you have problems with the spine, it's very good to strengthen it. So, pillows. Place your head onto the pillow. Knees bend, arms in front of us. And now the same thing, we do the rotation. So breathe in through nose, and when you breathe out, you come around, open up your chest, breathe back in. When you breathe out, you come back to neutral. Still keep that pelvic floor lifted. And again, 5 rotations. The pelvis doesn't move, the pelvis remains stable. Very good exercise to mobilize that chest. Good. And back to normal positioning. Lovely. I think I've done 3 now, so 2 more. Engage that core, lift that pelvic floor. Breathe in through your nose, out through your mouth. Think about breathing into that chest. Don't breathe into your abdomen. Don't lift your shoulders. Good. Well done, everyone. And then back to neutral. Lovely. Good. So the last thing I'm going to do is do 2 exercises in the 4-point kneeling position. Okay? Place your hands under your shoulders, knees roughly under your hips. If you're struggling with your wrists, you can also go clench 2 fists and go onto your fists, okay? Up to you, otherwise, hands on the floor. Now, first of all, I want us to mobilize our back a little bit. We're going to do a couple of cat and cows. I'm sure you've done that before, which is arching your back one way, and flattening it the other way, arching again, and flattening. Doesn't matter how far you can go. It's about being comfortable. In terms of breathing, I normally say breathe in one direction and breathe out the other direction. It doesn't matter which one you pick, but it's just a good way to mobilize the pelvis, mobilize the middle of your spine, mobilize your neck. Good. Well done. Right, 2 more. 2 cats and 2 cows, everyone. Just to mobilize everything a little bit. Good. There we go. There we go. Good. And now I want you to make that movement smaller again, like we did with the pelvic tilts. So you come back into your neutral pelvis. Okay. I don't want anyone to like poke out their bums, yeah? So that you shouldn't dip in here. And obviously you shouldn't be this way either. And most people let that bellies drop a little bit and then they're overarching here. If you then do the exercise, you put too much pressure onto your lower back, and that's not healthy, okay? So halfway between those 2 movements, and then you should notice that to keep that movement, you kind of have to engage your core a little bit, okay? Drawing that belly button, lift up that pelvic floor. And now I want you to focus on one bum cheek. Doesn't matter which one, but focus on one. Breathe in through your nose. And when you breathe out, I want you to clench that bum cheek and lift that leg off the floor with a straight leg. Don't bring it higher than your pelvis. So don't come up here because you end up tilting, yeah? You don't need to come as high. If you're here, that's fine. And then you bring it back in. And when you breathe out on the other side, you do that with the other leg. Clench that bum muscle, bring out that leg, come back in. And now I want you to just alternate one leg up and then back in. Make sure that you maintain that position in your spine and your pelvis. Don't arch when you bring out that leg. Take your time, doesn't matter how quickly you do it, and make sure you keep those bum muscles engaged. Good. So I want everyone to carry on, but if you want to make it a little bit harder, you can bring in the opposite arm, okay? So I'll show you my next one. And again, opposite arm out, and then leg back. Another side. So same principle applies though. Don't overarch. Don't move. You might wobble a little bit because this is also balance exercise. Make sure that you look down between your legs, so don't bring your head up, because then your neck won't be happy at all. And again, if that's too much for you, no problem at all. You just carry on with the legs. If you feel like your wrists are really struggling, even on your fists, you know, have a little break. You know, move those wrists a little bit, rotate those, come back. Okay, good. I want everyone to do 2 on each side. 2 on the right side, 2 more on the left side. Doesn't matter what level you're doing. Nice and controlled. Belly button is still drawn in. Pelvic floor is still lifted. You're breathing out. When we move our body parts away from the center, we breathe back in, back. Good, definitely. So everything, shake out a little bit. Well done, everyone. So we're going to do a couple of stretches just to release everything, but that's sort of it in terms of the hard exercises, okay? So well done. So I want you to lie onto your backs. Bring your arms up, either side of the spine. Knees together, thighs together, feet together. And when you breathe out, you drop your knees to one side, you look the opposite way, you go as far as you can, sort of thing, and just rotate that pelvis a little bit. Then at your own pace, you come to the center, and you do the same thing to the other side. Perfect, well done. And again. So I want everyone to do 4 on each side. Again, at your own pace, just to mobilize that spine, mobilize that back. Good. Well done. And again, other side. Rotate, relax into that stretch. Also very good exercise to mobilize your spine in the morning. If you feel like you're stiff, that's one of the ones I do quite a lot. You just have to sort of like see for yourself. Everyone is a little bit different. You can try a few stretches that might not be for you, but if you find something that helps you, it's good to know. If you do have a day where you don't feel that well, you've got a few ideas on what you could possibly do to ease your pain. Right, so I think I've done 4 on each side. Now I want you to straighten out both legs and just bring one knee in and just pull it towards your chest so you can feel the stretch in your bum. Hold it for a few seconds. Good, and then I want you to just bring it out a little bit. Make sure that you don't lift your opposite bum off the mat because it's very easy to follow, but I don't want you to follow, I just want you to stretch that hip joint a little bit. And then you do the opposite, you come across that leg, but now you are allowed to lift your bum, okay? And again, hold that for a few seconds. Well done, everyone. Good. Come back to the center and swap legs. Knee to your chest. Hold it again. Bit of tension just to release it. And now you bring it out. Make sure the opposite bum remains on the mat. Just have a bit of stretch in your hip joint. Hold that for a few more seconds. And then you come in and you do the opposite. Come across, lift up that bum if you can. Get the stretch on the outside. Good. All right. Well done. Good. And then I just want you to come back to the center and just bring one arm across your chest and just stretch that arm a little bit just because you were led on it. It's really important to stretch that shoulder as well. Relax your arm and swap sides. Good. Well done, everyone. Right, good. So now I want you to slowly sit up. And then I want you to slowly stand up as well. And I'm going to slowly stand up and place the camera back onto the chair first of all. So I just want us to finish in a stood up position. There we go. Good, that way is fine. So when you're up standing, I just want you to go back into your normal position. So feet hip distance apart, pelvis in that neutral position. Think about your abdominals once more. Think about that pelvic floor once more. What I want you to do is just take a deep breath in, lift up your arms, and when you breathe out, I want you to just go into like a little squat position, just swing those arms, come back up, breathe in, breathe out once more, come back up, bring your arms back in, and then you can give yourself a clap. And thank you, everyone. I hope you had fun doing these little exercises. Obviously, I'm going to answer a couple of questions as well in a minute. So if you've got any questions, let me know. Tell me how it went. Whether you had any problems.
Hi, Wiebke. Thank you. That was a fantastic session. You've done the much harder job this evening than I have. I have to say as well, I love your honesty on the harder exercises when you say, you know, these aren't nice to do, but you explain the benefits and why you do them as well. I think it's good to know that they're not easy for us to do.
Yeah, they're hard for everyone, and like I said to you, obviously when you've got multiple levels, if you do the level 1 and you lift your leg up and you bring it back down, you feel your muscles work, and that's the most important thing.
Absolutely, yeah. We've had a few comments coming in and lots of people watching and obviously joining in as well, so it's fantastic to see. So it'd be great to ask you a couple of questions that have come in, but also everyone watching, if you have any questions, please do add them to the comments. I'll make sure we go through them. I mean, firstly, we had a comment from Sylvia who said that she's been using Pilates following her hip replacement six months ago, and she said how fantastic that was. So hopefully she's enjoyed the session as well. And we had a question from Gillian, who's actually a trustee of NASS, so lovely that she's joined us this evening. She asked if there are any sort of seated Pilates exercises that she can do instead of the lying ones because she finds lying down difficult.
Yeah, so they're like, whenever I do I tell people to do seated exercise, I always say get a gym ball as well, actually. So do some exercise on the gym ball, because if you sit on the gym ball, you're already engaged in your core. I've actually got a gym ball here and I can show you. I just need to move you across and get the gym ball out. So if other people want to join in, that's no problem. Maybe I'll put you on the floor 1 second.
This is the joys of technology earlier. We're all getting used to it still.
So I'll show you this way. You can't see you might be able to see my face. So your ball. So first of all, when you get a gym ball, you should sit roughly so you've got 90 degrees at the angle here, 90 degrees at your knees. Yeah. So you don't want to be too high because then you can't maintain your balance. And if you're too low, you're kind of sitting on it and you're slouching on it, okay? Just so you know what sort of size you need to get. The good exercise to do on the gym ball is actually just sit up straight. Like I said, do 9 degrees here, 9 degrees there. Think of all that core engagement again that we spoke about when we were doing the Pilates exercises. And for example, just lifting one heel off the floor, lifting the other heel off the floor. And you notice even when you do that, that your core needs to engage more to stop you from falling over. When you feel more confident, you can, for example, lift up one leg, come back down, lift up the other leg, come back down. You can bring the arms back in, just have them on your hips. When you come back up and down, you can have them in front of you. Come back up, come out. So there are lots and lots of options to do on a gym ball. And that's what I normally say to people who want to do exercise on a seated surface. Get that gym ball, sit on the ball, and there are lots of movements. You can come out as well, bring your leg out as well, and you instantly notice how your core needs to engage to stop you from falling over.
Oh, that's fantastic. Thank you. Yeah, and I use a gym ball when I'm working at my desk as well. So I'll have some time with the gym ball, sometimes sat on a desk chair. As you say, even just sitting on it, you can feel your muscles really kicking in and starting to work. Oh, that's really helpful. Thank you. And we had one question from Linda, which it was relatively early on, and I think some of the exercises you did were probably helpful for her question, but just whether there are any other exercises that are helpful for upper back and shoulder blade pain and stiffness.
In terms of Pilates, what's quite good is actually push-ups against the wall. So very difficult to show here, but basically you go in a normal push-up positioning, place your hands on the wall, and depending on how far away you are from the wall, you put more pressure onto your shoulder blades. And you just go into the push-up positioning, you bring your face on your upper body closer to the wall, and you come back up. And depending on how you place your elbows, how you place your hands, you put different pressure onto your shoulder blades. That's when I actually like to do myself as well, or also gave to patients quite a lot who had problems with the upper body wall push-ups. Don't try to do the push-ups on the floor. And that's like a different story, but against the wall, very good.
Okay, excellent. That's a really good starting point. Thank you. And I think based on the comments that are coming in, we'll definitely be asking you for another session if you don't mind at some point.
So I enjoy Pilates, obviously, so I'm happy to share that with other people.
Wonderful, thank you. I'll just check if we had any more comments coming in. We've got a comment from Helen saying, "Fab, great session, and definitely something she wants to continue." So that's really great to hear. And I think, according to my technology, we've probably gone through all the questions. I'll give everyone just a few seconds in case any more trickle through. I know with my slow internet tonight, I don't want to miss anyone, but if we do, I can answer them in the comments afterwards, or ask you by email if that's all right.
Yeah, no problem at all.
So while we're just giving everyone just a few more minutes for any questions, I'll just repeat, the video from tonight will stay on our Facebook page. We'll pop it on our YouTube channel and on our webpage, My AS My Life, as well. So you can try the exercises again if you'd like to. And yeah, so yeah, no more comments in at the moment. So I'll just as well say for next week's session, our session is on Friday the 14th at 2:30 p.m. and I'll be joined by Dr. Danny Murphy, who's a GP and a staff grade rheumatologist. And Dr. Murphy will be talking all about your GP and how they can help manage your axial SpA and when to see them versus the rheumatologist and so on. So yeah, a different day to usual, Friday the 14th at 2:30 for that. Yeah, so I think we've covered all the questions there, Wiebke. Was there any sort of final thoughts from you? Anything you wanted to share?
No, that's pretty much it. But yeah, if anyone's got any questions, like always get in touch. I'm happy to answer those. And I just hope that everyone had fun. I certainly enjoyed doing it. So I hope I was able to help some people with their pain.
That's wonderful, thank you. And yeah, based on the comments that are coming in, we had lots of people enjoying it and finding it really beneficial as well. I've just seen we've had a few more comments coming in. Oh, it's lovely to hear. Debbie says, "Thank you, inspired me to start Pilates again." That's wonderful. And Linda says she's going to try with the wall push-ups as well to start with.
Lovely.
That's excellent. So thanks again. It's a really great session, and hopefully speak to you soon. And take care, everyone. Thank you for joining in, and see you next week.